Myself, Dr. Anupama GL, second year PG scholar from the Department of PG Studies in Panchakarma, Sri Sri College of Ayurvedic Science and Research, Bangalore. On this auspicious day, I wish everyone happy Dhanvantari Jayanti. I would like to start this occasion with invoking blessings from Lord Dhanvantari and Pujya Sri Ravi Shankar Guruji. Ayurveda, the science of life, is one of the ancient and comprehensive systems of healthcare. The quest for good health and long life is probably as old as human existence, and Ayurveda quenches the thirst of gaining good health and long life. Today, 29th of October, on the occasion of Lord Dhanvantari Jayanti, we also observe 9th World Ayurveda Day, celebrating under the theme Ayurveda Innovations for Global Health. Focuses on fostering Ayurvedic innovations to address global health issues. We Indians believe in the concept of Vasudhaiva Kutumbakam, and this year over 150 countries are joining together to celebrate the World Ayurveda Day. Focus areas of Ayurveda Day 2024 are women's health, workplace wellness, school wellness program, and food innovations. The initiative aims to engage the community and showcase the efficacy of Ayurvedic practices with activities like educational lectures on managing health and wellness. Hence, today, the Sri Sri College of Ayurvedic Science and Research Hospital, Bangalore, is organizing the webinar with this approach to celebrate World Ayurveda Day. I take privilege to introduce and invite our Puja Gurus to join with us as panel members for today's session. Dr. Ganesh Puttur sir, Head of the Department of PG Studies in Panchakarma, Sri Sri College of Ayurvedic Science and Research, Bangalore. Sir, being the eminent speaker, having rich clinical and teaching experience of 30 years, I invite him for today's session to share his valuable inputs. Welcome you, sir.
Thank you.
Dr. Divashri ma'am, Professor from the Department of PG Studies in Kaumarabhritya, Sri Sri College of Ayurvedic Science and Research, Bangalore. Madam, being a good orator with good teaching and clinical experience, I invite her for today's session to enlighten us. Welcome you, ma'am.
Thank you.
Now, by seeking permission, I would like to start the session. Sir, now Panchakarma is gaining significant global importance, and we hear a lot of Panchakarma treatments in the media. To give a clear picture to general public, what are these Panchakarma treatments? From the point of view of common man, can you explain it, sir?
Jai Gurudev. Happy Dhanvantari Jayanti Day to all the viewers. So it is the Panchakarma. It is really the fascinating word which we see in the media regularly. So everyone is fascinated and attracted by the word Panchakarma. As the word Panchakarma it tells, Pancha means 5, the Karma means the major, the detoxificatory procedures. In the human body, on day-to-day basis, the accumulation of the doshas or the toxins, it will happen and which will lead to the imbalances in the body and manifestation of different diseases. These are the Panchakarma procedures. The Pancha means 5, that is the Vamana, that is the vomiting procedure, Virechana, that is the purgation therapy, and 2 types of enema treatments, and also the Nasya, the administration of medicines through the nostrils. So with these 5 procedures, the detoxification, the imbalances in the body, those things will be rectified.
Thank you, sir. Namaste, ma'am. Among the 4 stages of life, Balyavastha plays the major role to build a strong adulthood. So, what role do early life Ayurveda practices play in building a child's immunity? Can you please explain us, ma'am?
Jai Gurudev, Om Dhanvantaraye Namaha. So as you rightly pointed out, focusing on the immune factors or the immune system right from early childhood is very essential. And so in the infantile age, this is the right period when the innate immunity starts building up. And so also Ayurveda says that it is asampurna dhatu balam. So the innate immunity is yet to be built up. So at this point of time, we need to focus upon the Navajata Shishu Paricharya as per the Ayurvedic classics to help build the immunity of the infant. So that is very important.
Thank you, ma'am. Sir, what is the importance of Panchakarma treatments and who all can take Panchakarma treatments?
This is a quite interesting question and very important each one of us to know it. So the manifestation of the diseases in the body, which can happen through the three types of doshas, they are the vata dosha, pitta dosha, and the kapha dosha. And accumulation of these in the imbalanced state, it will end up with the manifestation of the disease. On regular basis, when a person is having the disease, like it might be fever, cold, it might be the joint issues, the person will go and consult the doctor and take the medicines. So this will pacify the disease. So it is mentioned that a disease, when it is treated with the Panchakarma procedures, that is the Vamana, Virechana, or the two types of Bastis and Nasya, the disease is eliminated from the body by uprooting it. So if a plant, if a tree is there, if you remove it from the root level, then regrowth will not happen. Similarly, when a patient, when a disease, it is treated with the Panchakarma procedures, it is eliminated to the root. So there will not be any, once again, the manifestation of the disease in that individual. So this is the unique contribution of Ayurveda with the help of the Panchakarma procedures. So we have seen the 5 treatment procedures, that is when a person is suffering from the disease of the kapha dosha, then the patient is treated with the Vamana procedure. When a patient is having the imbalance or the diseases which are manifesting due to the pitta dosha, then the treatment protocol is to follow the Virechana therapy. And when a patient is having the diseases which are having the predominance of vata dosha, then the patient is treated with the Basti therapy. So with these Panchakarma procedures, when a patient is treated, the disease is treated from the root level itself, and there will not be any relapse of the disease. So the Panchakarma procedures, they dominate over any other type of treatment which is given to the patient.
Thank you, sir. Ma'am, can you suggest some simple Ayurvedic practices or routines that parents can adopt at home to support their child's overall health and well-being?
Yes, so that is what Ayurveda suggests, that Dinacharya is very important in the maintenance of physical health as well as mental health. So this is applicable to children also. So proper nurturing of children, so what we call it as Poshana in Kaumara Vidya, is very important for the physical and mental well-being. So what kind of Poshana should we do in children? So first of all, it is very important to give a healthy food to the child. So that is going to help in nurturing the body and the mind. So healthy food not only in terms of carbohydrates, fats, and proteins, but what we call it as a shadrasopeta ahara. So it should consist of sweet, sour, salt, bitter, astringent taste. So a food is complete only when it has all 6 types of rasas. So this is the first and very important step in nurturing the child for his physical and mental well-being. Second step is to do Abhyanga every day. So Ayurveda says Abhyangam Acharein Nityam. So this is very important in nurturing the physical and mental health. Thirdly, avoiding the use of gadgets. So nowadays infants are with gadgets, are born with gadgets. To avoid the mental health issues, it is very important to avoid the exposure to gadgets right from infancy. And fourth thing, the child must involve in the outdoor games. So play is very important to nurture the mind as well as the intelligence. So the child has to involve in the outdoor games, and traditional games of India will almost nurture the IQ of the child. So they are planned like that. So these are some of the routines that I suggest for a physical and mental health of a child.
Thank you, ma'am. Sir, in the present day, people are busy with their own commitments, and at the same time, people want to get benefits of Panchakarma. So, to give precise idea, how much time it takes to receive Panchakarma treatments?
Yeah, this is the common question which is asked by the patient: how much time they need to be in the hospital, or how much time, how many days they should keep for the Panchakarma treatments. So I would like to touch some other aspects also for the same question. That is, the Panchakarma is indicated for both the people, that is for the swastha or the healthy individual, and also the patients, that is who are having the disease or the problems. The aim of Ayurveda is to maintain the health of a healthy individual and also cure the disease of a patient. So with these two main aims, the Ayurveda works. So here, to take all the Panchakarma procedures, which takes a few months' time, wherein people cannot afford that amount of time. depending upon the complaints, depending upon the disease the patient is suffering, and also depending upon the age, depending upon the profession. By considering different factors, the customized Panchakarma procedure, Panchakarma packages can be done. For example, if a patient is having the diseases which are related with the Kapha dosha, then the treatment can be done through the Vamana procedure. That is, if a patient is having Tamaka Shwasa, then the patient can be treated with the Vamana procedure. If a patient is having the skin issues, which is having the Pitta predominant, like the eczema or the psoriasis or other such skin conditions, then the patient can be treated with the Virechana, which is best considered for the Pitta dosha. At the same time, the patient is suffering from the Vata or the joint issues, Vata-related issues, the patient can be treated with the Basti treatment. For example, if a patient is suitable for the Vamana procedure, then the patient need to allocate for about a couple of weeks treatment time for that. And also, if a patient is having the skin issues, then the patient may need to undergo both Vamana and Virechana, for which patient requires to keep about 3 to 4 weeks of time. At the same time, for the joint issues, this is very commonly seen in the after the age of 50 plus. For the joint issues, then the patient need to undergo the Basti therapy, which can be completed in 2 to 3 weeks of time. So depending upon the disease condition, depending upon the age, depending upon the patient for what purpose he has come, accordingly, patient need to keep about 10 days to 25 to 30 days of time for the disease for which he is suffering. And in this, very important to know is that few of the days, all the days, if the patient is there in the hospital admitted, it is excellent, well and good. Otherwise, the hospitalization for few days and rest of the days he can come from the home, or he can do some work from home, those facilities, and that can be done by consulting with the physician. So keeping about 10 days to 25 days, it is very much essential, and staying in the hospital for a few of the treatment for a few days is very much essential. This can be decided by consulting the Panchakarma doctor.
Thank you, sir. Ma'am, in this present era that may be due to improper diet and lifestyle, cases of childhood diabetes is on rise. How does Ayurveda approach this condition in young patients?
So childhood diabetes is also called as juvenile diabetes or type 1 diabetes, and usually it is considered as an autoimmune process, autoimmune disorder. So there are various treatment approaches, of course, but I would like to just brief it in a few steps. The first thing would be the achievement of the glycemic control. So where we put the child on anti-hypo or hypoglycemic agents. Along with, they'll be taking some insulin, and it will be difficult for them to withdraw from the insulin. So they'll be taking some hypoglycemic agents. And along with that, we need to focus on slowing down the autoimmune process. So this is what we do. The Amavata line of treatment, we do follow in case of childhood diabetes. We try to slow down the process of the autoimmune disorder. And third thing, and the most important thing, is the maintenance of ojas. Because in Ayurveda, diabetes is considered as a Vataja Vyadhi. Mostly it is a Vata Pradhana Vyadhi. So here, this is the period of growth and development. And during the period of growth and development, the child is on the peak of his Vata. So Vata Prakopa has occurred at this age of that we need to bring down the Vata and we need to nurture the ojas in order to maintain, to control the disease as well as to achieve a proper growth and development. So ojas is the focus of Ayurvedic treatment for childhood diabetes.
Thank you, ma'am. Sir, lastly, we see that we have different seasons in a year and they have impact on the body and health of an individual. How Panchakarma can help for these seasonal variations so that health of an individual can be maintained?
Yeah, so the few of the unique concepts are there in Ayurveda. One of that is the seasonal detoxification. A person can be healthy, he can follow the daily routine properly, he can be very perfect with the diet. Whatever it is done, still the effect of the weather or the different season will be there on the human body. According to that, there will be a normal increase in the Vata dosha, Pitta dosha, Kapha dosha will be there, and they will be accumulated in the body in a minimum level. So what happens? This minimum level accumulation or the increase of the dosha should be eliminated then and there itself. So then that is called as the seasonal purification. For example, for the vata dosha, pitta dosha, kapha dosha, the different seasons are mentioned. In these seasons, there is a physiological increase of the doshas. For example, now right time it is for the pitta dosha. The pitta dosha, it will be a physiological increase will be there in the month in the Sharad Rutu. That season it is the physiological increase of the pitta dosha. So that is from mid-October to December 15th is the right time for the elimination of the increased physiological state of the pitta dosha. So whoever want to maintain the health in a better way, so they can definitely take the Virechana therapy here. They need to consult the Panchakarma doctor, and the Virechana therapy will see that the whatever the accumulated doshas will be there, those things will be eliminated. Similarly, for the Kapha dosha, Vasanta Rutu is considered to be the accumulation of the Kapha dosha, which is from the mid of February to the mid of the April. So during this time, the people, the healthy people, they can come and they can have the Vamana treatment, which will eliminate the physiologically accumulated Kapha dosha. Similarly, for the Vata dosha, it is the Varsha Rutu, that is from the mid of June to the mid of the August. This is the right time to eliminate the physiologically accumulated Vata dosha. These are the 3 seasons wherein if a person regularly takes the Panchakarma procedure, the imbalances which are naturally, which is happening in all the individuals, they can be eliminated and person can be healthy all the time.
Thank you, sir. Now, due to increased digitalization and busy life, many children struggle with focus or hyperactivity today. How does Ayurveda understand and approach these concerns?
So this is a major concern nowadays, especially in cities like Bangalore. So what happens is the major cause of this hyperactivity disorder is the improper lifestyle of the pregnant woman. So there lies the cause. Of course, genetic factors also contribute, but the major cause lies in the improper lifestyle of the woman during her pregnancy. So because of that, there are many kids having predisposing, that is a predisposing factor to hyperactivity. And as I previously said, infants are exposed to gadgets at as early as 4 months of age or 6 months of age, because it is very convenient for the working mothers, or I can tell you nuclear families, to manage kids. Just give a gadget to the kid and make the kid sit with the gadget for hours together, and they are busy with their own work. So these are some of the major contributing factors. And what happens is there will be some kind of incoordination between the functioning of the manas and the buddhi. So buddhi is considered as the next level of manas, the mind and the intellect. So they are at different levels of functioning. So there will be some incoordinated functioning between this manas and buddhi in this kind of hyperactivity disorder. So we have definite protocols where we follow in our hospital. Of course, we have many such kids with hyperactivity disorders and inattention disorders with us. We have a set of Panchakarma treatment, as well as we have some sets of oral medicines, and we do have decide upon the line of treatment and the treatment protocol depending upon the condition, whether it is mild, moderate, or severe, or whether it is hyperactivity type or it is more of inattention type, and then we accordingly administer the treatments to such kids.
Thank you so much, ma'am. Now, Ayurveda Day 2024 celebrates both the ancient wisdom and modern relevance of Ayurveda, highlighting its role in addressing global health challenges through this year's theme, Ayurveda Innovations for Global Health. I wholeheartedly thank Dr. Ganesh Puttu sir for enlightening us with the therapeutic and preventive Panchakarma to the general public. Thank you, sir. I also thank Dr. Divashri ma'am for their gracious presence and sharing valuable inputs. Also, I thank Shri Shri College of Ayurvedic Science and Research Hospital, Bangalore, for arranging this webinar. I would like to conclude the session by quoting Sukartaha sarvabhutanam mataha sarvaha pravrittayaha sukam nasti vina dharmam tasmad dharma paro bhavet. All creatures are behind happiness. There is no happiness without righteousness. Hence, all should follow the path of righteousness. Jai Gurudev. Thank you so much.
Thank you.